what are all the causes? So this is a Omaha classification system, and around 90% of the cases are because of traumatic cases, either accidental or iatrogenic. It can be an acute, which can be seen within the first 3 days of trauma, or the presentation can also be in a late. So around 90% of the CSF rhinorrhea is because of the traumatic causes. And the other traumatic cause is iatrogenic. Non-traumatic causes, it can be because of a high pressure leak or a normal pressure leak. High pressure leaks in case of tumors and hydrocephalus, and normal pressure leak in case of congenital anomalies or osteomyelitis, or sometimes because of atrophy of certain parts of the brain will give way for the pressure, normal CSF pressure to act on the underlying bone, like an atrophy of olfactory bulb, and it may cause a spontaneous CSF rhinorrhea. So, because there are so many causes other than trauma in non-traumatic cases, whenever if we are doing a MR cysternography, you have to do a routine brain to see the other structures, and along with that, you add up 2 more sequences for the case of MR cysternography. So, before that, we should know the common sites of a CSF leak. The most common site in a case of a traumatic CSF is the anterior cranial fossa, because the dura is very adherent to the thin overlying bone. Any fracture in the bone will damage the dura and subsequently may cause the leak. The most common site is cribriform plate, and followed by anterior posterior ethmoid, sphenoid and frontal sinus and tegmental.